Hello, everyone. Welcome again to another Calculations Time with Dr. Dave. This time, I want to go over um, some points about prescriptions, how we look at prescriptions, and how we interpret them. Now, you should have already have some introduction as to how to read a prescription, but we're going to focus here on just reviewing some of the important aspects that are for calculations, as well as going over some ones that you might have not have seen for compounding prescriptions. So, keep in mind that when you are getting a prescription, prescriptions usually are given in two ways. In other words, you can get a written prescription that a patient will get from a prescriber, or you will see something which is typically in an institutional setting, which means that if you're in a nursing home or a hospital, you will see something called a doctor's order. These are the two familiar types that prescriptions are actually given, both the outpatient and inpatient setting. People will use different words for prescription. They might use prescription, prescription order. They might use the symbol RX. They might say, I have a script, as you can see, or I have an order, all meaning the same sort of thing. It's a prescription for the patient. And again, how it can come in, it could be written, it could be pre-printed. Now we have electronic means, electronic prescribing. Facsimile is still an option as well. I'm not going to go over who has the authority to prescribe, but you should know that there are certain people that do have the authority to prescribe a prescription. But what I want to let you review is that when you do get a prescription, right, either it's a prescription or a drug order, I'm going to call those a prescription. They will look differently. We'll go over those. But in a community setting, if you do get a prescription for a patient, oftentimes it's something that is a prefabricated dosage form. This here prefabricated dosage form, which just is a fancy word for meaning that the product is already something that's commercially made by a drug company or a manufacturer, and you are dispensing that or repackaging that and dispensing that to a patient on the order of a prescription. So those are the commercial products we call prefabricated dosage forms. Here's an example of what a prescription might look like that would have a manufactured product for us to dispense. You see that the drug name here is amoxicillin, the strength 250 milligrams in their capsules. The portion of the prescription that we call that is the inscription. And so the inscription portion of that is where that medication that's being prescribed, the strength and the dosage form. We have something called the superscription right here. This is just an indication of this is where the prescription starts. It used to be more of where we do compounding or recipe is where the recipe starts. The signa here, which is abbreviate usually SIG. Some people say, what's the SIG code? This is the SIG. It's the directions, right, of how the patient should take it, what you should write on the label. And this says 1 capsule PO/TID times 10 days. You would interpret that as 1 capsule. PO means by mouth. TID is 3 times a day. X 10 days means times 10 days, which is them taking 3 capsules a day times 10 days. This is why it's telling you to dispense 30. This direction of what to do or what to make or what to dispense is the subscription. Now, if the doctor did not, or the prescriber did not write this here, if they just put 1 3 times a day for 10 days, you should be able to do the calculation and know that there's 30 capsules that need to be dispensed. There's other portions of the prescription which you can read in the description component, but for the most part, I want you to be able to understand this is what a prescription would look like, and this is what you should be able to be interpreting the SIG, the drug, and what the directions are for what you should be dispensing. Now, the other thing that you will see, which looks a little different than those prescriptions, are compounded prescriptions. So this is another type of a prescription that you may encounter. When we say compounding, we mean that the product that you are going to dispense is not commercially available. You're not going to take something off the shelf and dispense it to a patient. You're going to have to make it in the pharmacy. So that's something that we say that you would prepare, mix, assemble, package, and label, right? So something you have to do all that for. There are some Latin abbreviations and some Latin terminology that is used. They are pretty much not common anymore in practice, but you will see some of them or some types of them, and you might be exposed to them on some exams. So we want to go over the really common ones. The first one that you see right here is a way in which the compounded product is written. You'll see that it's written with the drug names, and then it's also written with the inactive ingredient lactose being given. And you'd have to look at that and interpret what's going on. This is where we look down here. We have this M.FT.DTD caps number 10. So what does that really mean? Well, this MFT or this MFT, you're going to see this is an abbreviation for mix and make. So this is telling us to mix and make. The DTD stands for of such doses. And then it says capsules number 10. So this is a compounded prescription that's telling us to make 10 capsules. Each capsule, this is what DTD, each capsule will contain these ingredients. And you're giving that every 6 hours as needed for pain, PRN pain. So if I ask the question, how many milligrams of acetaminophen is in each capsule? The answer is 65. How much codeine phosphate is in each capsule? 10 milligrams, right? And how much lactose is in each capsule? Well, this one says QS to 300. The abbreviation QS means you add a sufficient quantity to get the total weight of the capsule up to 300 milligrams. There's another way in which you may see prescriptions written, sometimes even not compounded prescriptions, but just prescriptions that are written for commercial products. You'll see a strength of a drug written with a line like this coming down. What this is just like a decimal point. So this is somebody, instead of writing decimal points for a few things, they'll just put a line, and that's assumed to be the decimal point. And with that, there's two other assumptions. That line represents units, and the units are either going to be grams or mLs, depending upon if it's a liquid or a solid. So in this case, it says zinc oxide. It has a line with a 5 on the left side. That means that the left side is just going to interpret as if it was a decimal point. And I can interpret this as 5. And then I need to know whether or not it's grams or mLs. And in the case of zinc oxide, it would be grams. You're going to know that yet. But it's going to be grams. So this would be 5 grams. Calamine is also powder. That would be 5 grams. Hydrocortisone is also powder. This is 0.5, right? That's how that's being interpreted. And talc, again, is that QS. So you add a sufficient amount up to the amount for 58 grams in that case. All right. So again, it says apply to the affected area, TID. Again, you should know TID is 3 times a day. The last type of an abbreviation that you may see in some compounded prescriptions is the abbreviation AA. It might be by itself, or it might be AA with a line over it, and that means of each. When you see that, if you see it in a prescription, for example, this says Benadryl elixir, which is the liquid form of Benadryl, and then it gives nothing here. There's nothing here, right? But then it goes to the next ingredient. It says nystatin oral suspension, and it says AA 10 mLs. What that means is this AA means of each. That means that there's also, you would assume an AA here, and this is saying 10 mLs. So this is saying that you want 10 mLs of Benadryl plus 10 mLs of nystatin. Anything above this AA is going to be the exact same amount. That is a little different than what we saw in the beginning. Here we have DTD, which means of such doses, which means everything has a unit on it, and it's telling you how much to put into the capsule. Here, it's telling you of each. So both 10 mLs of nystatin plus 10 mLs of Benadryl would be in the formula. And then you would QS. QSAD is the same exact way of saying QS, or add sufficient quantity up to, and 120 mLs. The direction says MFT, which is mix and make a suspension. This is 1 tablespoon. This is a bad abbreviation for tablespoon. It should be the TSBP. But it says 1 tablespoon, swish and spit 4 times a day and at bedtime. So if you're doing it 4 times a day and at bedtime, this would be 4 plus 1 more time at bedtime. So they're doing it 5 times a day is what they're using that at. So for compounded prescriptions, for the most part, you're going to see them listed, like I said, with a drug and ingredient listed down as though as if it was a recipe or a formula for you to make. The only thing you have to be looking out for are these abbreviations: DTD, mix and make, what it's telling you to make, as well as if you see the AA, which means of each. So in this prescription here, if you were to compound this in the pharmacy, you would take 10 mLs of Benadryl, 10 mLs of nystatin, and you would QS or add a sufficient amount of Mylanta until you got up to 120 mLs. So if you wanted to look at some of the directions and get a little practice, again, we have that mix and make, and the abbreviation UNG is an abbreviation for UNG, which is going to be ointment. This here, it says mix and make, and then divide into poles, and that's number XL. This is XL number we should know from our Roman numeral section that we're taking 50 minusing the 10. That would be for 40. Right? So this says basically mix and make poles, which are capsules in a sense, 40 of those. And then we have mix and make a suspension number 12, X11, right? We should know what that is. This is not too emphasized. Again, this is something that is more from a traditional standpoint of pharmacy. Most things now are not like this. They're usually written more in the SI units and have a little bit less Latin abbreviations associated with them, a more modernized approach. So those are prescriptions, right? So we're talking about how a prescription looks from a patient's perspective, getting it from a community pharmacy, let's say. And now when we're talking about the institutional types of pharmacies, we're looking at those medication orders. And the medication orders are something that is going to be, like I said, typically for most people are going to encounter that in a hospital setting as a pharmacy student when you see that. So they're either handwritten, electronic, or verbal orders that can be taken. And instead of being written on individual sheets of paper like a typical prescription, you might think they're written in doctor's orders or electronic doctor's orders. And they are literally instructions as to what's going on. And a lot of times you have to dig through the instructions to look at the drugs. But you can see here, you're going to start seeing drugs. You're going to see Tylenol, 650 milligrams by mouth every 4 to 6 hours as needed for temperature greater than 38. You see another drug, Percocet. So you're going to see things in which the prescriptions are going to be ordered. We're going to look a lot of these types of prescriptions when we deal with IV medications, because a lot of IVs are usually given in those hospital settings. So things that are injectables and IVs, for example, this drug here, it says Phenergan 12.5 milligrams, IV, Q6 hours, PR and nausea. This IV is not Roman numerals, it's for intravenous. Over here we have an order that says to start a liquid, which is LR, which is lactated ringers, and it says at 125 mLs per hour IV every 8 hours. In calculations, what we'll be dealing with is understanding that that's an IV order for a medication that's a liquid to be given every hour. They want 125 mLs of that to be infused intravenously, right? And that's going to be given every 8 hours. So looking at the abbreviations and looking at some Latin abbreviations that you see and being able to interpret prescriptions is very important for this course. So understand that you will see medication orders, you will see prescription orders, and you will see compounded prescriptions that we'll be looking to assess and interpret. Now, in terms of some common abbreviations and symbols you will see in the books and as other sources that you will see, you might have already been exposed to these during orientation time, is that you will have some primary prescription abbreviations and symbols that will become second nature to you as you move along in pharmacy. We're going to be looking at one of the most common ones in this course. So there's a comprehensive, or I shouldn't say, an incomprehensive list is in your textbook. That table 4.3 has a very nice amount in there, but there is tons more. But we're going to look at the most popular, like I said. So let's look at some of these prescriptions here, and let's look at what's good, what's bad, and how we can interpret that. So here we have the drug. Again, it's lisinopril. It says 5.0 milligrams. The sig is 1 QD, and the amount to dispense, XXX, which we should hopefully know is 30. And when we do that, we know that it's 30. We don't know if the tablet or capsule doesn't say, but in this case, we're looking at how to interpret at least the sig, which is 1 QD, which is 1 a day. What's bad about this is that you shouldn't have that 0 there. If it's just 5 milligrams, the more appropriate way is just to have 5 mg and no decimal point with a 0. It could be misinterpreted for 50. For the synthroid, as you see in the next example, we've got 0.125 milligrams. This can also be written as 125 micrograms. It's 1 in the morning, which is what 1 QAM means. 1, the Q means every, the AM means morning, and this is number 90. So that's how much you should be dispensing. Right? So that leading 0 in front of here is very good. You would not want to ever do this, 125 milligrams. That can be mistaken as 125 milligrams without somebody seeing the decimal point. So in pharmacy, it is very important that we put a 0 in front of that to indicate that there is a decimal point. So there is no misinterpretation that that is being 125 milligrams. There are these other symbols that are shown below that you will become familiar with in the apothecary type of abbreviations. Here we have a drug which is Phenergan with codeine. This C with a line on it, when somebody does that, that is with. So you will see the way in which you would read this is the word Phenergan. This C with a line over it means with, and then it's codeine. So Phenergan with codeine syrup, it's cough syrup. Here we have SIG, and we're looking at something that is an abbreviation for a fluid ounce. You will be looking at that fluid dram that we see in this case right here. So this right here, when it's written in the SIG of a prescription, will be interpreted to equal 5 mLs. And I might want to try to do this a little bit better if I can. But that's what it's going to look like. So when it's written like that, it is 5 mLs. So this SIG is saying give 5 mLs, 1 teaspoon, which is 5 mLs. Every 6 hours is needed for cough. The 4 ounces, we will be able to interpret that in mLs. We will eventually know that the common equivalent is 30 mLs per ounce. So 4 times 30 would be 120. So it would be 120 mLs that would be dispensed. And the next one here, we have amoxicillin, which is a suspension. It's 250 milligrams per 5 mLs. If you're dispensing 1 teaspoon, that's the abbreviation for teaspoon, every 12 hours for 14 days. Right? 1 teaspoon is 5 mLs. Right here. That 1 teaspoon that we want to know is equal to 5 mLs, something we definitely want to be aware of. If you see something that's a tablespoon, right, this is 15 mLs. And we learned over here that if you see that fluid dram symbol in the SIG, so meaning in the directions, and it's got something that has Roman numerals after it, or 1, right? Anything like that, this is going to be interpreted as 5 mLs when it's in the SIG, right? When it's after the SIG. If it's not in the SIG, it's going to be interpreted differently, which I'll show you. So here it's a cod liver oil suspension, and we have another symbol, right? But notice over here that it's in the SIG and it's also in the dispense fluid ounce as well. So this is an abbreviation for fluid ounce. The fluid ounce here that we have to worry about is that this is telling us to take SS. What is that? It's not a Roman numeral that we know of. That's an abbreviation for half. So this is telling us to take half of what this is, right? Which is 30 mLs. So it'll be 15 mLs, right? PCBID, so twice a day after our meals. It's telling us to dispense, right? We know that this, every time we see this symbol here, which is that symbol there, you're going to be looking at 30 mLs, and this is 5, 6, 7, 8. So it would be 8 ounces is what that's trying to tell us. Or 8 times 30, 240 mLs. All this is in your book, and it is written there. The book does a good job as to getting the details of this clarified for you, but they do have one missing thing in the book. You will see that it says, right, the symbol right here that we've shown right here is 5 mLs when it's in this the SIG. That is correct. And then it says the symbol SS is 15 mLs. No, the symbol is not SS. They want this symbol, the one that we have right here. This is what's supposed to be put there. So it's supposed to be this SS is equal to 15 mLs. So it's missing that symbol in the book electronically when you see it. So keep in mind that there is a little error in the book. All right. So with that being said, that is a very quick overview that you should get after listening to the in-class lecture and reading the chapter so that you can see some examples and just reiterate the content from both. All right. Thank you. And as always, pharmacy calculation is the most important class because it's the only one that counts.